Welcome back. So Defend Our Democracy and other civil society organizations other civil society representatives, I beg your pardon, have expressed concerns that the country's health institutions could become sites of looting and corruption. In fact, earlier this week, they demonstrated outside the Gauteng legislature about this very matter. For more on the organization's thoughts, let's bring in Nonkululeko Mntambo, who's a communications officer at Defend Our Democracy. It's great to have you on the program, Nonkululeko. Thanks very much indeed for making time. You know, the state of Gauteng health, many might say, is a real example of just how much can go wrong if corruption is allowed to essentially go rampant. But what has happened over the past few months is that the more we've uncovered, the more we've realized just how deep the rut runs. And that's raised questions around whether we feel whether any of this could ever be fixed.
Thank you for having us on. I think you're quite right in the questions that you ask. And just to add on to that is that we are at our most vulnerable when we witness how these systems are cracking down and how they affect the most vulnerable of us. So it is a matter of urgency for it to be fixed, and it's not something that we can have as a choice whether it can or can't be, but as a matter of when, really.
Yeah. That protest that took place earlier this week, the Defend Our Democracy organization was hoping to hand over a memorandum. That's to the Premier's office. I presume that took place. Take us through exactly what you're calling for.
So with the picket that took place at the Gauteng Premier, at the Gauteng legislature, what we were definitely, of the highest things we were calling for were systems of accountability which are institutionalized. We've seen a lot of the burden of accountability falling on whistleblowers, and it has become very dangerous and it becomes unsustainable. And so amongst our highest calls was for institutionalized systems of accountability, and then going further into report backs on what has happened at your Tembisa hospital, at Charlotte Maxeke, at Rahima Musa, and things of that nature, for us to get feedback and to get a way forward as to how these things are going to be fixed.
Yeah, it's difficult to speak about corruption at Gauteng Health and not mention Babita Deokaran's name. She, according to many, I think rightfully so, say she's paid the ultimate price for trying to speak out against alleged graft in government. But there are also real concerns around the chilling effect that her killing might have had for other people who might have wanted to speak out.
Absolutely. And that's exactly why we need these systems to be institutionalized and to be picked up systematically and not by human hands. Of course, there has to be systems that protect whistleblowers themselves, which is what was amongst the calls for on our memorandum. How are these people going to be protected? How are they reporting? What happens post the reporting, so that the life of Babita is not taken in vain? There has to be something that follows up from this moment. However, what we've seen is that there definitely has to be a removing of the burden from your everyday staff to there being systems that can be checked, rechecked, corrected should they be breaking down, so that these things can be picked up on time.
Yeah. You know, civil society organizations have been calling or sounding the alarm around corruption in Gauteng Health for years now. I wonder, on the back of this latest protest or picket, what you reckon it will take for us to start seeing meaningful change?
So for us as Defend Our Democracy, we've set this as a groundwork for many other actions to come, be it protest, be it picketing or showing up to certain offices, or even taking it the legal route. We believe definitely that the only way there's going to be adequate response is when there's adequate noise, because unfortunately, and it's something that one could never believe they could say of their own country, but apparently death is not enough. The suffering of the people in the hospitals is not enough. The suffering of the medical staff is not enough, who are bearing way too much burden that from even before COVID and have yet to recover from. So clearly that is not enough. So there has to be even greater confrontation, be it on the legal front, in the constitutional courts, in our on the streets, wherever it needs to go. But there definitely needs to be a noise.
Yeah, we do know that the SIU has ended up investigating payments, dodgy payments amounting to about 850 million rand, specifically from Tembisa Hospital. Defend Our Democracy has been asking for an update on how that investigation is going. Has the SIU said anything yet?
So on the day of our picket, the Premier Panyaza Lesufi was was given the SIU report, and we ourselves are looking forward to hearing it. But we do know that those two moments intersected, so we are waiting quite in great anticipation to see what it has to say.
All right, Nonkululeko Mntambo is the communications officer with Defend Our Democracy. Nonkululeko, thanks very much indeed for your time.